Good morning, folks. How's everyone doing on this fine Tuesday morning? We've got some really interesting stuff today, and I'd love for you all to join in on the conversation. In case this is your first time with me, I'm Addison Clark. I graduated from San Diego State University in the year 2024 and earned my degree in public health and Spanish. I took a few years off to travel the world to now work as a statistical researcher for the World Health Organization. As COVID-19 involves the study of epidemiology, this was right up my alley. Today, we have the opportunity to learn more about the racial disparities that exist within the COVID-19 pandemic that we've all grappled with for quite some time now, unfortunately. With a little bit of perspective, it becomes quite clear how some experiences are more challenging than others, depending on the color of your skin. To truly unpack this contextually complicated issue, let's begin with a few focus questions I've received from you guys. First off, what is considered the standard or factual historical overview of racial disparities in medical care and its relevance to the African American community in the past? Historically, African Americans have been treated as though their health needs are of lesser importance. Long before COVID-19 was even on the horizon of our future, the Black community has always been a victim of the system. And few things have changed as COVID-19 has hit us. Anyone remember Henrietta Lacks? Yes, she is a prime example of the impactful effects racial disparities have had on the Black community in the medical field. Or perhaps the African Americans like Henrietta who could only go to one specific clinic because all the rest refused to help her. As an individual speaking to all of my listeners today, COVID-19 is a common issue among all of us. Yes. But the effects are widespread and can be seen most drastically by the Black community day in and day out as their death rates rise and discrimination in healthcare continues to persist. This leads me to my second question. What has my research revealed about today's approach to medical racial disparities in the Black community? Research has shown that there has been little change to address the disparities that exist within the medical world. The other day, I was talking to one of my friends who works at the American Public Media Lab, and she had told me that of all the race groups in America, more African Americans have died from the coronavirus than any other. She said, and I quote, "If they, African Americans, had died at the same actual rate as white Americans, about 21,800 Black Americans would still be alive today." This made me think hard. I fell upon this idea of how America's social determinants of health prevent African Americans from being able to obtain the same amount of medical attention other races do. From my years of studying in public health, with the help from the Center for Disease Control, demographic trends concerning income, employment rate, and the education are all contributing factors in the disparities that exist between African Americans and other races. With some African Americans being on the lower side of each factor, it leads them to be able to seek less medical attention. I actually wanted to take this time to share one of the experiences my friend, who is African American, had. She said, "My niece went to this hospital and they wouldn't wait on her because she didn't have insurance. They told her she would have to go to the county hospital. So I had to take her to the county hospital. She was bleeding all the way there. It was just terrible because she didn't have insurance." The same thing is happening with COVID-19. Some African Americans cannot get medical help because they don't have insurance or a local healthcare provider or big enough paycheck, widening the gap between the races that have access to medical attention even more. Speaking to the future, this brings me to my third and final question. What is needed to further our understanding of the complexities of racial disparities in the pandemic and its impact on the future of the African American community? The racial disparities need to be understood by all races, not just those who are immediately affected by the situation at hand. Society splits when half of us are blind to the struggles the other half of us face. I say we use our resources, the power of technology and personal agency. With this, we begin to embed the awareness of racial biases into, as quoted by Harvard Health, medical education as well as an institutional policy. I know it's hard to talk about things like this, so we push them under the rug instead. But I'm hoping that by you listening in on this webinar, you've all gained a little more insight. Thank you for joining me, and catch me next time with a surprise guest speaker. Make sure to tune in.